Welcome back everyone to the second part of Syndromic Hearing Loss revision series. Previously, we discussed about autosomal dominant syndromes. In this podcast, we will focus on autosomal recessive conditions. Usher syndrome is the most common autosomal recessive syndromic hearing loss. It is also the most common cause to dual sensory impairment, in which patient suffers from blindness and deafness. This is due to gene mutation myosin 7A or CDH23. It can be divided into subtypes depending on the degree of hearing loss and the onset of the blindness. Type 1 is where patient suffers congenital severe to profound sensory neural hearing loss with vestibular dysfunction and onset of retinitis pigmentosa in the first decade of life. Type 2 is the most common form of Usher syndrome. Patient with type 2 Usher syndrome suffers with mild to severe sensory neural hearing loss with normal vestibular function and the onset of retinitis pigmentosa between first or second decade of life. Type 3 is progressive sensory neural hearing loss and vestibular dysfunction with variable onset of retinitis pigmentosa. Retinitis pigmentosa is an abnormal accumulation of pigment on the retina, which manifests as night blindness and progressive visual field loss. Juvel-Lang-Nelson syndrome, also known as cardio-auditory syndrome, is the third most common cause to hereditary autosomal recessive hearing loss. This is due to the mutation in potassium channel genes such as KCNQ1 or KCNE1 gene. Patient presents with congenital hearing loss with prolonged QT interval on electrocardiogram. Affected individuals may have cardiac abnormalities, recurrent syncopal episodes, and sudden death. Biotinidase is an enzyme that helps recycle water-soluble vitamin biotin. The deficiency is a treatable inherited condition. Clinically, it is characterized by a variable sensory neural hearing loss associated with neurological, ophthalmological, and dermatological abnormalities. This is due to the mutation of the BTD gene. If it is left untreated, patient may suffer from seizure, muscle weakness, ataxia, developmental delay, eczema, hair loss, visual problems, and hearing loss. This condition can be easily treated by supplement of biotin. Refsum disease is a member of a family of genetic disorders known as leukodystrophies. It is caused by faulty phytanic acid metabolism, resulting in the accumulation of phytanic acid in blood plasma and tissues. Patient may present with varying signs and symptoms such as arrhythmia, retinitis pigmentosa, peripheral neuropathy, cerebellar ataxia, anosmia, and progressive sensory neurohearing loss. Goldenhar syndrome is a rare congenital condition characterized by abnormal development of the eye, ear, and spine. This syndrome occurs sporadically or randomly. Hence, it may have an autosomal dominant, recessive, or multifactorial inheritance pattern. Some studies have suggested that this disorder may be caused by the interaction of different genes and possibly combination with environmental factors. It primarily affects the first and second branchial arch structures. In most cases, malformations are unilateral. However, in approximately 10 to 33% of affected individuals have bilateral malformations, with one side typically more affected than the other. In majority of the cases, the right side is more severely affected than the left. The signs and symptoms can be divided into eyes, ears, and spine. Eye signs include dermoid cysts on the eye. Coloboma occurs when some soft tissue in the eye fails to close, presenting with a notch of varying sizes. As for the ears, patient may have external ear deformity such as microtia, anotia, and middle ear malformation, which causes congenital conductive hearing loss. Inner ear malformation includes vestibular cochlear nerve malformation, semicircular canal, and oval window malformation, causing sensory neural hearing loss. As for spinal malformation, patient may have absent spine, scoliosis, or fused vertebrae. Other abnormalities include mild developmental delay, congenital, renal, or cardiac malformation. An example question is a 5-year-old child presents with severe sensory neural hearing loss with imbalance and blindness. Which gene mutation is most likely to cause this abnormality? The answer is myosin 7A, which is the gene mutation for Usher syndrome. SLC26A4 causes Pendred syndrome. KCNQ1 causes Javel-Lange-Nielsen syndrome. BTD gene is biotinidase deficiency gene, and PAX3 causes Waardenburg syndrome. Thank you very much for listening. We'll be discussing on X-linked hereditary hearing loss in the next lecture.